So when we look at longitudinal measurements, this is really one of the benefits of the ISQ, how we can get measurements at the time of placement and then look at times. And certainly when this is looked at longitudinally, there's a decrease in that 2 to 4 week time when the transition phase is happening between primary and secondary stability, which again is where we don't want to do a lot of manipulation of that implant when the ISQ value dips down. And then it'll go, of course, back to baseline levels or hopefully even higher depending on the integration, the osseointegration that occurs in that patient. And then this is going to be a measurement that can be increased at the time of loading because certainly when it's going to have more forces on it, we want that implant to perform well and respond to the physiologic forces. So the importance of longitudinal measurements to follow osseointegration are really important. And then we can also utilize the longitudinal measurements to predict failing or ailing implants to help us determine if we want to intervene or if an implant really needs to be removed so that we don't continue to waste time and potentially have more bone loss and more destruction in that site.